There's a lot of reason that people avoid the dentist, and they know they have dental needs that need to be taken care of, but they don't. I have found that for some people it's time. They just can't make the time to get here. For some people it's financial. They're just not at that right point where they're ready to delve into the finances of dentistry. But for the vast majority of people that have dentistry that needs to be done, that are not getting it done, the problem is anxiety. They're afraid. They've had bad experiences. We have a very systematic approach to helping our patients overcome anxiety. The first step is just to have a good relationship. Let us just get to know each other through our consultation, through time together. But normally, in order to build that friendship that helps you get over anxiety, we really need repetitive good appointments. So you come in first time and you're nervous. The second time you're a little less nervous because we know each other better and we develop a rapport. Third time, even better. However, sometimes your needs are so pressing that we don't have time to do that. That's when we rely on medications to tackle anxiety. And so we can offer what we call oral conscious sedation, which is some pretty significant sedation where you are more or less awake and alert and you're able to respond. And that's why we like it, because sometimes I might need you to bite a certain way or stick your tongue out or something like that. So I need you just a little bit alert. But oral conscious sedation allows us to write you a prescription for a strong medication for you to take before you come in. You got to have a driver, so I strongly recommend that you have your driver there when you take it, and you take the medication. They bring you into the office, and by the time you get here, you are on cloud 9. You are the happiest person in the building, and the anxiety that was keeping you from having your dental needs served is now gone. We take every precaution to make sure you're healthy the entire time you're here. We measure your oxygen content, your blood pressure, your heart rate. We make sure you're very, very healthy. It's a very, very safe way of getting over the anxiety. And what I found in my practice for new patients that come in with anxiety, which is something I see 3 or 4 times a day, we need that oral conscious sedation right off the bat. However, after 2 or 3 appointments, most of my patients that needed oral conscious sedation early on, they don't need it anymore. We've had enough happy appointments in a row, enough anxiety-free appointments in a row that we don't need it anymore. It's a wonderful tool for us to get over any obstacle that prevents you from getting your mouth in optimal health.